North Korea had a life expectancy of 69.8 years in 2013. While North Korea is classified as a low-income country, the structure of North Korea's causes of death is unlike that of other low-income countries. Instead, it is closer to the worldwide averages, with non-communicable diseases, such as cardiovascular disease, accounting for two-thirds of the total deaths. A 2013 study reported that communicable diseases and malnutrition are responsible for 64% of the total deaths in North Korea, those of high-income countries and South Korea, but half of the average 57% of all deaths in other low-income countries. The same 2013 study stated that the largest obstacle for understanding the accurate health statuses of North Korea is the lack of the validity and reliability of its health data. Health infrastructure. Health care in North Korea includes an alleged national medical service and health insurance system. North Korea's government claims that it provides universal health care for all citizens. Defectors and some health professionals working abroad with contacts to North Koreans claim that health services only exist for those who can pay for them. North Korea claims that health services are offered for free. In 2001, North Korea spent 3% of its gross domestic product on health care. Beginning in the 1950s, the DPRK put great emphasis on health care, and between 1955 and 1986, the number of hospitals grew from 285 to 2,401, and the number of clinics from 1,020 to 5,644. There are hospitals attached to factories and mines. Since 1979, more emphasis has been put on traditional Korean medicine, based on treatment with herbs and acupuncture. A national telemedicine network was launched in 2010. It connects the Kim Man-yu Hospital in Pyongyang with 10 provincial medical facilities. North Korea's healthcare system suffered a steep decline since the 1990s because of natural disasters, economic problems, and food and energy shortages. By 2001, many hospitals and clinics in North Korea lacked essential medicines, equipment, running water and electricity. In 2010, the World Health Organization described the healthcare system as the envy of the developing world, while simultaneously acknowledging that challenges remain, including poor infrastructure, a lack of equipment, malnutrition and a shortage of medicines. Who criticized an earlier Amnesty International report that described barely functioning hospitals as outdated and factually inaccurate. Health status. Life expectancy. North Korea has a life expectancy of 69.7 years. The 2009 gender breakdown was 72.8 years life expectancy for females and 64.9 for males. Non-communicable diseases. Cardiovascular disease as a single disease group is the largest cause of death in North Korea. The three major causes of death in DPR Korea are ischemic heart disease, lower respiratory infections and cerebrovascular disease. Non-communicable diseases. Risk factors in North Korea include high rates of urbanization, an aging society, high rates of smoking and alcohol consumption amongst men. Approximately 54.8% of all North Korean adult males smoke an average of 15 cigarettes per day. Smoking prevalence is slightly higher amongst the urban worker population than the farming population. Amongst men, a high rate of excessive alcohol consumption has been reported, defined by the World Health Organization as consumption of more than one bottle per sitting per person. Infectious diseases. Infectious diseases, such as tuberculosis, malaria, and hepatitis B, are considered to be endemic to North Korea. An estimated 4.5% of North Koreans had hepatitis B in 2000. 2003. North Korea is experiencing a tuberculosis epidemic, with 5% of the population infected with the disease. This has been attributed to the overall deterioration in health and nutrition status of the population, as well as the rundown of the public health services. Infections that cause pneumonia and diarrhea are the leading causes of child death. 1/3 of the school-aged children in North Korea have diseases caused by intestinal parasites. HIV/AIDS. Who estimates that North Korea has less than 100 people with HIV/AIDS. According to UNAIDS, less than 0.2% of North Korea's adult population has HIV. Officially, the country maintains that it is completely free of AIDS. Malnutrition. During the 1990s, North Korea was ravaged by famine, causing the death of between 500,000 and 3 million people. Food shortages are ongoing today, with factors such as bad weather, lack of fertilizer, and a drop in international donation meaning that North Koreans do not have enough to eat. A study of North Koreans in 2008 found that 3/4 of respondents had reduced the food intake. Extreme poverty is also a factor in the hunger faced by North Korean people, with 27% of the population living at or below the absolute poverty line of less than $1 a day. These food shortages cause a number of malnutrition diseases. For example, a 2009 UNICEF report found that North Korea was one of 18 countries with the highest prevalence of stunting among children under 5 years old. Bibliography. Country profile. North Korea. Library of Congress, Federal Research Division. July 2007. Retrieved 4 July 2009.